safeguarding society from infectious diseases. Striving for a healthy nation with less chronic diseases. Building a healthcare system with personalized medicine. KCDC are striving for a disease-free world and a healthy Korea. Korea's Centers for Disease Control and Prevention, the KCDC, has designated notifiable infectious diseases and implemented a comprehensive effort for communicable disease control to protect people healthy and secure. Most communicable diseases are now under control. However, new and re-emerging infectious diseases and bioterrorism attacks can occur at any time, resulting in a public health crisis. To prevent the importation of emerging infectious diseases, preventative measures are taken through entry point inspection at quarantine stations. To prepare for an outbreak, KCDC has secured medical resources such as therapeutic agents and designated hospital beds and provided risk communication to the public. Also, joint exercises and education with private, public, and military sectors against biothreats have been conducted to enhance the response capacity. The prevalence of tuberculosis has dropped significantly compared with the past. Still, the incidence and mortality rate is number one. There are 40,000 new TB patients and 2,500 subsequent deaths annually. KCDC plans to reduce the current incidence by half in 2020 and has established the action plan to achieve this goal. Since 1954, various vaccines have been introduced to the National Immunization Program, and several vaccine-preventable diseases have been controlled to elimination levels. Currently, more than 20 vaccines are implemented for children and adults at all private and public hospitals. Aging in the 21st century has resulted in a growing number of non-communicable diseases, or NCD. Consequently, the associated medical costs have put a heavy financial burden on households. The prevalence of NCD is projected to increase, and it needs the national support and policies for prevention and control. Accordingly, KCDC controls diseases and supports evidence-based policies by surveillance system and epidemiological investigation. It also supports community-based public health programs on NCD. As a national biostatistics producer, KCDC endeavors to provide accurate information along with personal health practices and disease control methods. Organ dysfunction and failure due to chronic diseases necessitates sharp increase in demand for organ transplant. KCDC operates the Korean network for organ sharing to ensure timely and transparent management in organ transplantation. Also, KCDC campaigns to promote public awareness about organ donation and transplantation. With the advancements in medicine, there has been an increased use of blood products, which poses concerns of unfortunate yet unavoidable adverse effects. KCDC is operating a comprehensive blood safety management system, including blood center management and follow-up investigations. KCDC serves to protect donors and recipients. KCDC, a global leader in public health research, sets up value openness, cooperation, and challenges for the future. In order to uphold these values, KCDC is leading health-related researches in Korea based on 5 strategies: advancing the health research infrastructure, leading creative research for the future, strengthening the capacity to plan and manage research on health and medical care, developing new medical technology, and reinforcing domestic and international collaboration. As a national research institute that has earned public confidence, KCDC invests its resources into various types of research in the fields of health and aging, acute and chronic diseases, vaccines against new variant infectious diseases, treatments for chronic illnesses, women and low birth rates, and the genome study of Koreans. Korea CDC, established in 1945 as a national principal agency for public health, has evolved throughout history. Korea CDC consists of the Headquarters for Diseases Prevention and Control, the National Institute of Health for R&D, and the National Quarantine Services in 13 major ports and airports. Nestled in the heart of the Osang Health Technology Administration Complex, built in 2010, Korea CDC has been leading the establishment of an outstanding biomedical cluster in Korea. Increasing health security from infectious disease outbreaks, improving the quality of life by non-communicable diseases control, producing R&D projects for tailored healthcare services, the KCDC proved its value with tremendous achievements. Korea now has the capacity to produce and test vaccines and blood serums and has officially been declared as a smallpox and polio eradication zone, as with other member states in the Western Pacific region. Also, Japanese encephalitis and hepatitis B have been successfully controlled through the implementation of the National Vaccination Program, and Korea became the first to identify the causes of diseases which had previously been unknown, such as Legionella and Leptospira. The Epidemic Intelligence Service System has been implemented to promptly determine the route of infection and prevent the spread of infectious diseases. And through the web-based infectious disease surveillance system, youthful health information has been provided to the public. In addition, Korea gained worldwide recognition for its excellence in disease control and response after successfully preventing the introduction of SARS to the country and declaring measles and lymphatic filariasis eradication. Furthermore, the National Biobank of Korea was established to create a foundation for personalized medicine and new drug development. KCDC, carrying out research on advanced medical technologies and securing the necessary resources for the future, is striving to become a world-class institution by successfully establishing and operating the National Biobank of Korea, the National Center for Stem Cell and Regenerative Medicine, the National Center for Medical Information and Knowledge, Biosafety Level 4, KCDC plans to contribute to the protection and promotion of public health in Korea by executing 6 plans under 2020 5-Star Plus, with all the programs and projects implemented based on the 4 values: service, change, creation, and rewarding contribution. With human lives as its top priority and focus, KCDC will continue its dedication to research on diseases to protect national health and improve the quality of life. For the secure country that we can trust. To the happy life that we can think. For your health and security, Korea CDC will make people's dreams come true.